fatal overdoses related to fentanyl have risen exponentially in Canada in the last couple of years, and now there have been 2 recent deaths here in Newfoundland and Labrador. That's too many. There's more that can and should be done. While government's opioid action plan was a start, there are major gaps. For instance, will the Minister of Health commit to making Naloxone kits available in our province's pharmacies, similar to what has been done in places like Ontario?
The Honourable Minister of Health and Community Services.
Thank you very much for the question, Mr. Speaker. I agree to an extent with the member opposite that 2 fatalities are too many. What I would say is that the plans and preparation that were put in place between the Department and the regional health authorities have actually saved 14 lives in 2 weeks. I don't think that is something that should be forgotten in this. With regards to the specific question about Naloxone, pharmacies in this province have them currently. We have kits that are still available for individuals and community groups. 811 can provide access to those kits.
Nice. The Honourable Member from Mount Pearl North.
And I agree with the Minister to an extent. The efforts of our first responders in recent weeks have been absolutely heroic. But calling 811 is not enough. We aren't reaching those that are at greatest risk. Naloxone kits are dispensed free of charge at over 1,000 pharmacies in Ontario. Kits are only available at our pharmacies if you can afford them. Today, pharmacies only have access to the commercially available kit that costs $85. The free kits being distributed by government cost about $14. Why won't the Minister commit to immediately distributing kits province-wide to our 50 addictions and pain clinics?
The Honourable Minister of Health and Community Services.
Thank you very much, Mr. Speaker. Our Naloxone kits, the ones to which the member alluded, that were distributed and put together with the aid of SWAP and some community groups, are available in addictions clinics. They are available for any group or any individual who feels that they would benefit or have others with them who would benefit. The issue of availability is moot, as there are still kits that have not been sought or claimed. So there's still capacity in the system. 811 is simply a contact point whereby individuals who want those kits can find out how to get them.
The Honourable Member from Mount Pearl North.
Mr. Speaker, in my own community, there's a clinic that has 100 patients coming every day, 7 days a week, and there is no Naloxone kit provided. In the government's current opioid action plan, there is no mention of any role or involvement for pharmacists. They see people every day who are at risk. Pharmacists are trained to give injections, and they can also educate those that need instruction. I ask the Minister, will you follow Ontario's lead and engage our province's pharmacists in tackling this crisis?
Good.
The Honourable Minister of Health and Community Services.
Thank you very much, Mr. Speaker. I've had meetings with both panel and the Pharmacy Board about the drug issues and Naloxone kits. Once again, there are kits to be had. Any clinic that feels it needs them, any individual that feels it needs them, has the opportunity to access them, and I would encourage them to do so.
The Honourable Member from Mount Pearl North.
Mr. Speaker, I had someone call 811 yesterday. They took a message. They were called back and told, yeah, go to Pleasantville and we'll train you how to use a kit. How is that a province-wide solution for our pharmacies and for our 50 addictions clinics? As of today, Royal Newfoundland Constabulary officers still have not received training on Naloxone. We cannot afford to wait any longer. Will the Minister of Justice commit to immediately addressing this problem and provide all first responders with appropriate tools and training?
The Honourable Government House Leader.
Thank you, Mr. Speaker. And the first thing I would say is that obviously as Minister of Justice and Public Safety, I'm actually not responsible for all first responders in the province. That responsibility falls on a number of different departments. But it does give me an opportunity to reference the one of the incidents very recently, which was at Her Majesty's Penitentiary, where we did have an overdose. And this is an opportunity publicly right now for me to thank the first responders there, the guards, who took the time and saved that person's life by providing by administering Narcan and providing CPR. And thanks due to the training and the presence of those kits there, we managed to save that life. So again, I'm sure steps will be taken to address this issue, which is national and which is growing, and certainly we're not immune to it. And thankfully, we do have good frontline staff here reacting on a day-to-day basis. Thank you.
The Honourable Member from Mount Pearl North.
Mr. Speaker, our first responders have done an exemplary job. In fact, many lives have been saved as a result of their efforts, but there are still lives being lost during this crisis. Public engagement and education needs to be much stronger as well. Government's fentanyl information sheet that has been sent to schools is not adequate. It's poorly presented and even suggests that media reports have been inaccurate on this issue. Will the Minister of Education commit to immediately improving information and resources available to our schools and available to our educators?
Good job.
The Honourable Minister of Health and Community Services.
Thank you very much, Mr. Speaker. It's interesting the member opposite references the information sheet. That has the Department of Health and Community Services stamp on the bottom, and as recently as yesterday we have edited it and revised it in the light of feedback, and will continue to do so. If the member opposite has some constructive comments as to how he would like us to edit it, please feel free to let me know. It's a work in progress. Thank you.
The Honourable Member from Mount Pearl North.
Mr. Speaker, I'm relieved to hear that it's being revised, and I'm happy to help with that process. People are dying. Despite the Minister's statements back in January, the crisis is here and it's real. Will the Premier immediately establish a new task force coordinating efforts between the government departments of health, justice, education, children, seniors and social development, and engaging key community partners like the SWAT program and Street Reach? We need to move much faster. We need stronger action and we need leadership now.
The Honourable the Premier.
Thank you, Mr. Speaker. Well, when you look at how you respond to any particular actions, Mr. Speaker, the swiftest way to do it is leave it in the hands of some critical, like a minister like our Minister of Health and Community Services. And as the member opposite just talked about, what is required is swift action to this real tsunami, as some people would call it, sweeping across our nation, Mr. Speaker. The department will be responding, but we will give every single member in this opportunity an opportunity to feed into what some people are calling a crisis, Mr. Speaker. One life lost is one life too many. Let's get to work together on this particular issue.
The Honourable Member for St. John's East Kitty Bitty.
Thank you very much, Mr.